More and more adults are experiencing skin conditions such as eczema, and nappy rash is extremely common in babies. Could ingredients in cosmetics and baby products such as wipes be aggravating these conditions? And what can we do about it? I'm pleased to welcome now Mary-Louise, midwife and mum to 10-month-old Georgie, and consultant dermatologist Dr. Alexis Granite. Dr. Alexis Granite, we're seeing an increased prevalence of eczema. What are the possible factors behind that?
Yeah, so eczema is actually estimated to affect about 20% of the population, and approximately 20% of children will develop eczema within the first 6 months of life. And this rise is thought to be due to exposure to potential things like pollution and potential allergens, including things in skincare like preservatives, fragrances, alcohols, and perfumes. And these exposures can exacerbate eczema not only in babies and children, but also in adults. And in fact, many wipes, even those specifically formulated for babies, may contain certain ingredients that can disrupt the skin barrier and potentially trigger eczema.
Mary-Louise, you're a midwife, you're a mum of a small baby. What's your experience been with your baby daughter and nappy rash?
Yeah, so nappy rash is extremely common in general. And in fact, some research undertaken by WaterWipes found that 88% of parents reported that their babies did in fact get nappy rash. And my baby girl has particularly sensitive skin, so this is something that I can really relate to personally as well. There are some really simple things that you can do to help prevent and also to manage nappy rash. And those are things like making sure that your baby gets lots of nappy-free time to let that skin really breathe. Also making sure that rather than rubbing the skin dry after bath time, you simply just pat it dry to avoid any friction there. And also making sure that, really obvious one, but you do change your baby's nappy really regularly as well to avoid that irritation.
There was a study recently about nappy rash surveying hundreds of babies. Tell us more about some of the findings from that report.
That included 698 babies, and it was conducted by the University of Salford. And it found that when babies were cleansed with water wipes, that they were less likely to develop nappy rash. And if they did, then it lasted a less amount of time when compared to other leading brands. And this can go to show that brand can be an important factor when trying to keep nappy rash at bay.
Alexis, adults who are living with skin conditions such as eczema might benefit from choosing a wipe with minimal ingredients, mightn't they?
Yeah, exactly. I mean, in fact, it can be quite difficult to avoid many of the ingredients that exacerbate eczema because they are so commonly found in many different skincare products. And additionally, ingredient labels can be quite challenging for consumers, particularly those who are shopping for skincare products for sensitive or allergy-prone skin. And avoiding things like fragrance and preservatives that can disrupt the skin barrier and potentially trigger eczema really is a very important step in managing the condition. So choosing products with minimal ingredients like WaterWipes, which is formulated with 99.9% purified water and grapeseed extract, can really help to benefit those who suffer with eczema.
Mary-Louise, during pregnancy, hormones change all sorts of things in the body. One of those is the way your skin might react. Tell me more about the risks of eczema in pregnancy.
It's better to actually opt for more natural products, fragrance-free or unscented, to make sure that the skin can really then have an opportunity to retain maximum moisture. If you do experience eczema during pregnancy, which is common, then it is important that if you do wish to treat yourself, that you make sure that any medication at all is checked with either your midwife or your GP to make sure that it is safe to use during pregnancy.
Dr. Alexis Granite and Mary-Louise, thank you both so much for joining me.
Thank you.
Thank you.